So you've got a broken bone. That probably means weeks stuck in a hard plaster cast. But have you ever stopped to think about what's going on underneath it all? You know, the layer that's right up against your skin. Well, it turns out that hidden layer might just be one of the most critical parts of the entire healing process.
It's a really simple question, right? But the answer, well, it makes all the difference for your comfort, for your healing, and for how you recover. So what is the most important layer under a plaster cast?
To really get why this underlayer is such a big deal, we've got to understand the challenges that come with wrapping a broken limb in plaster in the first place.
I mean, just think about it. Wrapping a hard cast directly onto your skin? Oof, that would be a total nightmare. It could cause constant irritation on skin that's already swollen and super sensitive. It could trap moisture, which slows down healing. And then there's taking it off. Yeah, nobody wants any bad surprises there. On top of all that, for the cast to even set properly, the plaster needs a smooth, stable surface to stick to.
So how in the world do you solve all of those problems at once? Well, you use a solution designed specifically for that critical space between your skin and the cast.
It's called Orthoban Plus, and at its core, it's pretty simple. It's a protective, absorbent cotton padding. Its entire job is to be the perfect barrier between your skin and that hard outer cast. So how does this one layer make such a huge difference? Well, it all comes down to 3 key benefits.
Let's break them down.
It's all right here. First, it protects. This padding is literally engineered to shield that sensitive skin from the rough, hard plaster. Second, it promotes a better healing environment. You've got a cushioned, breathable layer, which also happens to make getting the cast off way easier. And finally, it provides. It gives the plaster that perfectly smooth surface it needs to form a strong, effective cast.
So let's take a look at how this protective layer actually fits into the whole casting process.
The process is super clear and logical. You start with the patient's skin. Then you apply the Orthoban Plus padding. This creates that essential buffer. And only then is the plaster cast applied over the top. It's one simple step, right in the middle, that changes everything.
And the difference is like night and day. Without this padding, you're looking at a risk of skin irritation, a tougher healing process, and a difficult removal. But with it, you get cushion protection, a better healing environment, and just a smoother process from start to finish.
And for the practical side of things, it comes in various standard widths, so it can fit different parts of the body, everything from a small wrist to a larger leg. It really all boils down to this single idea. It's the crucial layer of cotton that protects skin, promotes healing, and makes recovery easier. That's why a material that seems so simple is actually so essential. It's a pretty powerful reminder, isn't it? That in medicine, sometimes the simplest innovations have the biggest impact. So how can just one thin layer of padding completely change a patient's entire journey to recovery?